Hi, I'm Rose Hayden with Hunt Regional Healthcare, and today I'm talking with Dr. Cassidty Duran of Lamb Vascular and Associates about vascular disease. Thank you so much for joining me today.
It's a pleasure to be here. Thanks for having me.
Yes, and let's jump right in. First of all, what is vascular disease?
So vascular disease encompasses several different disease processes that go on basically in the blood vessels. So we have two sides of the blood vessels in our body. Our arteries deliver blood out to the different parts of our body, and our veins bring the blood back to our heart. Anything that involves a disease process of either side of the system encompasses vascular disease.
Okay, and who experiences vascular disease?
Well, it depends on which kind. So vascular disease in the arteries is in a particular patient population, and that's the people that I see who've had strokes or heart attacks, people who have bad circulation in their legs. Generally, we're referring there to people with arterial disease. Vein disease, on the other hand, is much more common. It's estimated to be that 40% of people in this country have vein disease. These are people that have swollen or heavy legs, varicose veins, and that's a much less worrisome disease process in terms of its impact on your life, but can be very lifestyle limiting, so also important to take care of.
Okay, and you mentioned stroke. What are the other causes of vascular disease or vein disease?
Well, so I would say stroke isn't necessarily a cause, but it's associated with. Any blood vessel in our body can get disease, and if one artery has disease, it's very likely that other arteries in our body have that same disease. So the same process that causes the arteries of the neck to narrow down, which can cause a stroke, can cause the arteries in the heart to narrow down, which can cause a heart attack. That can also cause the arteries that go to our legs to narrow down. That causes poor blood flow, which is the thing that I focus most of my practice on, making sure that people don't have sores that don't heal on their feet, pain in their legs and feet, keep them from walking, and can actually lead to amputation of their legs.
Very good. That's important. And so how does someone know they need to visit a vascular surgeon?
So I always start with saying we need to talk to our primary care doctors. They're so crucial in the care of our patients who have so many different things going on. Diabetes is very common, high blood pressure, but anybody that has, especially those two disease processes, diabetes and high blood pressure are commonly associated with vascular disease. Also high cholesterol, and the most important factor is smoking. So anybody who's had either a current history of smoking or even that smoked in the past, there are standard studies that are recommended to be done that check the arteries to make sure that you don't have vascular disease and something going on that could lead to a big problem down the road.
Good information. And so what procedures then does a vascular surgeon do?
So I operate on basically any blood vessel below the chin and down to the toes unless it's attached to the heart. The arteries attached to the heart, that's the heart surgeons, and the aorta is the big blood vessel that comes off the heart carrying blood for the rest of the body. Up in the chest, that's the heart surgeons. Everything else is something that would be in my domain of care. So the aorta and the abdomen can get enlarged. That's called an aneurysm, and we operate on those. Arteries down to the legs. That's a big part of vascular care, is maintaining circulation to the legs. Also, that's called a leg angiogram or sometimes a bypass procedure. Vein disease, I do procedures where I either do vein stripping or injections to treat varicose veins and to help with leg swelling and pain. That's a very common thing that we take care of. Carotid surgery, where I open up blocked carotid arteries either as a treatment of stroke or prevention for stroke. And I also operate on dialysis patients who need access to go on dialysis long term.
That's very good. And so does Medicare and other insurances pay for this?
Absolutely. So unlike some processes that people have to deal with in terms of healthcare, where sometimes there's a little bit of question about whether or not that's something insurance is going to pay for, vascular disease is without question something that everything gets covered.
Oh, good.
It's such an important disease process to treat, to keep people living as actively and healthfully as they can, that there's really no argument in terms of coverage by any insurance company. These things all get paid for.
That's wonderful. And so does a primary care physician refer to you, or how does somebody come to see you?
So there are a few different ways. Oftentimes, most often, it's through a primary care doctor, or when a patient's been seen in the hospital and they carry a different, for example, if someone goes into the hospital for a different reason, say pneumonia or COVID recently, and it's found at the same time that they have signs of vascular disease, oftentimes there will be a recommendation. You need to see a vascular surgeon when you're out of the hospital. Very commonly, primary care doctors will see patients with complaints of like swelling or pain or trouble walking, and those patients will come to me through referral. And then some patients, having heard from situations like this where they get a little bit of education about vascular disease, say, that sounds like me. I'm going to call them. And most of the time, depending on insurance, you don't need a referral to come see me. So patients can actually self-refer and just make an appointment and we can talk.
Very good. How can someone lower their risk of vascular disease?
Absolutely. Numbers 1, 2, and 3 are quit smoking. Smoking, as with many disease processes that we deal with, is the number one culprit in vascular disease. And so when I see patients who have blockages in their arteries, that's my number one recommendation. Not only to help them with, for example, the pain in their legs and to avoid amputation, but actually to avoid stroke and heart attack. Because like I said, if one artery in your heart in your body has this problem, all of your arteries probably do, and smoking is a big culprit. Other than that, managing diabetes and high blood pressure well, those things also help lower your risk. But some of this is genetic. When it comes to genetics, there's really nothing we can do to prevent, so it's all about recognition and management. And that's where we step in.
Very good. And we are seeing a lot of this in our area, and so we want people really to take it to heart, understand what we're saying, and know that this may be the case and something that they need to address. So any last advice for our viewers?
I would say just call. Regularly, what we see is that people will go weeks and even months with a misdiagnosis, and so if there's any question, I would far rather tell my patients, you know what, everything looks okay and you don't have to worry, then have them come in and say, oh my gosh, I wish we'd seen this 6 months ago. So if you're ever unsure, just give us a call and we're happy to check you out and make sure that everything's good.
That's great advice, and we've heard a lot of good information today. We want everyone to take great care of their health, and Dr. Duran, thank you so much for your time today.
Thank you so much for having me. I look forward to being a part of this community and taking care of the patients here.
Thank you.
This video has been brought to you by GEUS 34. GEUS is your community-owned provider for electric, internet, cable TV,